Good afternoon, and thank you for joining me at the annual Influenza Awareness Kickoff campaign. My name is Raquel Fomanowitz. I'm the Operations Administrator for the Health Department, and you should know that this is one of the most important events of the year for us. But this year's campaign is especially exciting because it comes at a time when the world has heightened awareness around the need for influenza vaccination to ensure the prevention of illness and disease in their community. But before we disclose the details of our exciting campaign, I'd like to thank Chancellor Santiago for his staff for hosting this event here at the UWM Student Union. I'd also like to thank the Health Department for helping administer flu shots today, and over 260 dedicated employees who have worked tirelessly and diligently to improve the health of Milwaukee residents during the spring H1N1 outbreak and the continued work this fall. I'd like to introduce Mayor Tom Barrett to say a few remarks.
Thank you very much, Raquel, and good afternoon. Getting a flu shot is one of the most, if not the most effective way to prevent infection and to prevent the spread of illness in our community. I think all of us in the community have a heightened awareness of the flu this year because of the H1N1 virus that is also prevalent throughout the United States. But we are here today to talk about the seasonal flu and not the H1N1 flu, because it's also important for as many residents as possible to become vaccinated against the normal seasonal flu that hits us every fall in Wisconsin. This year, there is a need to receive the protection against both the seasonal influenza and the new H1N1 or swine flu. But people should know that the seasonal flu, the normal flu if you will, causes more than 200,000 hospitalizations and about 36,000 deaths in the United States, mostly in people older than 65. However, the flu can and does affect people of all ages. And serious problems from influenza can happen at any age. The Center for Disease Control is estimating that more than 130 million doses of seasonal vaccine will be available during the 2009-2010 influenza season. We are here today to urge all residents in the city of Milwaukee and the Milwaukee area to receive vaccines to help them fight off the seasonal flu. I urge everyone to come forth and get these shots right now. I also urge everyone, when we get the H1N1 vaccines, to receive those vaccinations as well. By getting these flu shots, you'll reduce your risk of getting sick this winter, and you'll be less likely to spread the disease to others. That's what we're here for. And I am pleased to see so many people on the UWM campus who are already engaged in the process of getting their vaccination. We want this to continue at every site in the city where the city is offering these vaccinations, and we'll continue to spread the word that in order for us to make sure we don't spread the flu, it's important to get these vaccinations. To talk a little bit more about this in depth is Dr. Swain from the Milwaukee Health Department. Doctor?
Thank you, Mayor. I'm Geoff Swain. I'm the Medical Director for the Milwaukee Health Department and Associate Professor at the UW School of Medicine and Public Health. I feel like I should give Mayor Barrett his honorary MD. In fact, I really couldn't have said it better than he just got through saying it. The fundamental point is that we are encouraging everyone to get a shot against regular seasonal influenza today or as soon as possible, and to get a shot against the novel H1N1 as soon as they become available. We are encouraging everyone to get both shots, but I want to especially emphasize some high-risk groups that are really especially important to get these shots. For regular seasonal flu, that includes people who are age 50 and older, pregnant women, people who have a chronic medical condition like asthma or diabetes or heart disease, healthcare workers, people who are caring for high-risk individuals, anyone who's got a child under 6 months of age in the household because they're too young to get the flu shot. These are the categories that are particularly high risk for seasonal flu. Again, everyone should get a flu vaccine, but especially those folks. When the novel H1N1 vaccine becomes available, we expect that sometime in October, there's similar but not precisely the same risk groups for that vaccine. Again, healthcare workers, again, pregnant women, again, anyone who has a chronic illness like asthma or diabetes or heart disease. But for the novel H1N1 vaccine, we're also recommending vaccination, especially for young people, aged 6 months to 24 years of age, because those are the people at the highest risk for the novel H1N1 illness. But again, as the mayor emphasized, and I will say again, we are encouraging everyone to get a flu shot this season, and that means 2 shots. So get a vaccination against a regular seasonal influenza today or as soon as you can, and get a vaccination against the novel H1N1 influenza as soon as that vaccine is available. These are simple steps that will protect you and your loved ones from serious illness this season.
Thank you, Joff. As the health department emphasizes every year, vaccinations against influenza is the best way to keep yourself and your loved ones safe from this serious illness. It's so important that this year we've partnered with the Brewers and we've partnered with the Bucks to get the word out. As you can see, today we are announcing an outdoor marketing campaign featuring Brewers starting pitcher Giovanni Gallardo, right fielder Corey Hart, a second baseman Ricky Weeks, as well as a school poster campaign starring Bucks guard Charlie Bell. We have already partnered with Two Story Creative and Clear Channel to spread the message on large billboards and transit buses throughout Milwaukee. Students will soon see Charlie Bell posters within their schools that remind them to stay home if they are exhibiting any signs of respiratory illness such as fever, cough, or sore throat, and reminding them to continue good hygiene practices such as frequent hand washing and covering your nose and mouth when coughing or sneezing. We're excited to have Brewers Executive Vice President of Business Operations, Rick Schlesinger, here today. Rick?
Thank you, Raquel. We're pleased to be a partner with the City of Milwaukee and the Milwaukee Health Department in this initiative, and I applaud the efforts of our officials to be proactive in spreading the word, pardon the pun, about the importance of flu vaccinations. And again, our players, I want to thank Giovanni Gallardo, Ricky Weeks, and Corey Hart from the Brewers for participating in this campaign. And I think that if a billboard with a Brewer player and a Bucks player and with the mascots here doesn't convince you to pay attention, then we've got other issues. But again, very pleased to be part of the program. And again, as a parent of 3 small children where we deal with the flu every season, it seems like the flu shot is something that'll be part of our family. And we're hoping that everybody in the city takes advantage of this very easy and proactive step to avoid the flu. Thank you.
Great. In closing, I'd like to once again emphasize that regular seasonal influenza and swine flu too continues to be a serious concern throughout our community and the nation. I'd like to also reiterate a sincere thank you to Milwaukee Health Department staff, and we urge everyone to follow our recommendations in order to slow the spread of disease in Milwaukee. I'd like to now open it up for questions from our media partners.
Do we know how many doses of H1N1 vaccine are available in Milwaukee?
So we don't know the precise number of a novel H1N1 vaccine that will be available to Milwaukee, but we do know that there will be at least 150 million doses nationwide, probably more, and these are going to be apportioned to states in proportion to population, and then likewise to cities. So, we expect to have sufficient vaccine to meet demand. However, it will initially get it sometime in the first half of October, and then we'll be continuing to get shipments over time. So we may not have enough for everyone right away, but we'll continue to get them over time. So eventually we should have sufficient to meet demand.
Any other questions? If not, we'll head over to the clinic for a photo op. All of our speakers are scheduled to get their annual flu shot, and I will get the flu mist. Thank you.